Greetings, this is the coronavirus update for 4/23/2020. COVID-19 is killing a disproportionate number of Black and other minority Americans. Is America not treating some Americans right? Let's look at some news headlines first. Now, when you're reading things about any kind of race-related issue and coronavirus, you got to really be careful of a few things. First, watch out for sensationalized headlines from people who don't know what they're talking about, and listen to what the experts are saying. So here's what I mean by a sensationalized headline. Why is coronavirus killing so many Black Americans? Because they are poor. Nothing was said in this interview with experts here about anybody being poor. The topic poor wasn't mentioned anywhere. Because too many have been left behind economically in the richest country of the world. Well, GDP, yeah, we're the richest country of the world, but GDP per capita is what you should be talking about here if you actually went to college and got a degree in something other than journalism. You're writing for the Arizona Republic because why? Because they apparently are desperate for people. Nothing based on your writing skills or your ability to do research. This is just total BS. So let's listen to the expert here and forget about what the reporter wrote in this article and forget about her questions and her headline.
With us. My first question is, first, how is it affecting minority groups? You had a story come out this weekend, last week.
Right. And actually, it was a story a couple of weeks ago where we talked to a lot of experts about what kind of impact this might have on people of color. And much of them talked about, while every population is vulnerable, of course, what is particular about people of color is they're disproportionately impacted by some underlying health conditions, asthma, diabetes, heart disease, all those things that make them particularly vulnerable to the complications of coronavirus. One of those things is these groups calling for all of this attention, or trying to bring attention to the needs of this community, calling for the racial data. Some groups have long before the coronavirus have been stepping up to try to address disparities, especially healthcare disparities, particularly faith leaders, churches. I did a story maybe a year ago about all these religious leaders having this big conference in a church to talk about how they can do things in their church, whether it be stop serving fried chicken on Sundays, whether it be to turn the parking lot into a track so that folks could walk around. So groups have been stepping up along the way to do this anyway. I think now the sense of urgency is obviously right in your face because the virus is affecting every community.
Okay, we hear a lot about the governor of New York, Cuomo, and the governor of California. And, most governors in the country now have really educated themselves on coronavirus. Just half the population of the United States has educated themselves on coronavirus. So this is a lady who I would also consider an expert because she says some pretty intelligent things here. So let's listen to what she has to say.
Continue to distance ourselves. If we don't heed what we've seen happen in other cities, our population will be at risk. Our biggest outbreak in the state came from 2 funerals, by and large, in Albany, Georgia. And so for us to go back to opening up houses of worship just seems a bit premature to me.
Atlanta, of course, has a large African-American population with underlying conditions. You said some of the highest asthma rates in the country as well.
So, as I said, a lot of Americans have educated themselves about coronavirus. So let's listen to what Beyonce says about race and coronavirus.
The doctors, the nurses, and other healthcare workers who are away from their families, taking care of ours, we continue to pray for your safety. To those in the food industry, delivery workers, mail carriers, and sanitation employees who are working so that we can be safe in our homes, we thank you for your selfless service. Black Americans disproportionately belong to these essential parts of the workforce that do not have the luxury of working from home. And African American communities at large have been severely affected in this crisis. Those with pre-existing conditions are at an even higher risk. This virus is killing Black people at an alarmingly high rate here in America.
Now, I'm mentioning this here because there's something about this topic later on. Beyonce led off by, giving praise to healthcare workers. And healthcare workers are disproportionately being infected and dying, as a occupation, as an industry. And healthcare workers are predominantly white. So, we have healthcare workers treating, all Americans, and there's no racial disparity in who gets treated and who doesn't, despite what you might hear. Later on, we'll take a look at this. You probably haven't heard anything like that, except for in social media. Now, this guy, Dr. Jerome Adams, happens to be the Surgeon General of the United States. So you have to consider him an expert, right? He's a Surgeon General. He's going to talk about a disproportionate COVID fatality rate in minorities. So listen to what he has to say. Consider him an expert too.
Trends we're observing regarding the impact of COVID-19 on communities of color. And you've heard the stats in New York City. Hispanics represent the majority of deaths. In Milwaukee County, Blacks are 25% of the population, but almost 50% of the cases and 75% of the deaths. So what's going on? Well, it's alarming, but it's not surprising that people of color have a greater burden of chronic health conditions. African Americans and Native Americans, develop high blood pressure at much younger ages. It's less likely to be under control and does greater harm to their organs. Puerto Ricans have higher rates of asthma, and Black boys are 3 times as likely to die of asthma as their white counterparts. As a matter of fact, I've been carrying around an inhaler in my pocket for 40 years out of fear of having a fatal asthma attack. And I hope that showing you this inhaler shows little kids with asthma all across the country that they can grow up to be Surgeon General one day.
Now back to some headlines. As we heard before from an expert, asthma and diabetes and heart conditions are all underlying conditions that affect minorities a lot more than the general population in the United States. But this is a NYU being New York University, a study that, a pretty big study that found that obesity is the single biggest chronic factor in New York City's hospitalizations. So this was kind of surprising to have this come out. And, we know all these underlying conditions make it more difficult to survive, the disease, COVID-19. But the biggest single factor is obesity. And again, that would affect minorities more because minorities are more obese than the general population of the United States. So, before I emphasize, watch for sensationalized headlines and listen to experts. We heard the experts. Another thing you have to watch for is racial tensions in social media. Why? Because let's look at some meddling now. Meddling by Russia. Now you might wonder, what the hell does Russia have to do with racial tensions in social media? We'll see in just a minute. Now this might sound a little bit crazy. I thought it was crazy. Is America not treating some Americans right? Let's look at some meddling. So you hear about, the last election you heard about Russian meddling in the election. Well, that's kind of what they're doing now, only this is meddling, in the election, but right now the focus is on coronavirus instead of the election. They'll probably shift this to being more political later on. But right now, Russia is involved in meddling in the United States. And let's take a look at what CNN is doing here.
How long have you been working for the IRA, for the troll factory?
For my own people.
But you're actually doing it for Russia, so you might want to explain to God that there was a mix-up.
The aim? To pit Americans against each other and create mistrust of the political system.
Now here's an interesting looking photo of Obama and Michelle and Melania and Trump, and you can see the Trump, something looks wrong with that photo. Look at it looks like he's been squished a little bit. I'm the same height as Obama, and Trump is 2 inches taller. And Michelle Obama probably makes 3 Melanias. So a little bit of photo alteration going on there.
A CNN investigation has found that Accra, Ghana was the launch pad for an online operation to stoke racial tensions and stir up social unrest in the U.S. ahead of the 2020 election. On Twitter, Facebook, and Instagram, hundreds of accounts churned out posts about issues such as racism and police brutality in the U.S. Many even implied they were in America. We all are sick and tired of the violence that's taking place in our communities. In reality, they were here, in a nondescript house on the outskirts of Ghana's capital.
This is the compound where the operation has been based. There's no sign for an NGO. We're about an hour outside of the city, and you can see this is a very secluded residential area. And people here have been telling us that about 3 weeks ago, Ghanaian security services showed up here, raided the building, and no one's been back since.
National security tells CNN that all of EBLA's funding came from Russia. After the raid, the accounts went quiet for a few days. Then on Instagram, the group changed their handle names and started posting again.
Finally managed to convince our EBLA contact to agree to talk to us on camera. We're not going to show her face to protect her identity.
She tells us she was hired in September of 2019 and had no idea she would be working as a Russian troll.
Tell me more about your training.
So we were trained to use relevant hashtags. So if I'm posting about Black Lives Matter, I shouldn't add a hashtag about probably Beyonce.
Okay, as I said earlier, watch out for sensationalized headlines. When you read something racial about COVID-19, just look at the headline, see if it makes any sense. Because you've heard from the experts. You heard what the experts said about, the reasons for for COVID-19 affecting minorities more than the general population of the United States. So when you read a headline that says something different, then be suspect that the person just, was a mindless, person with maybe a bachelor's degree in journalism. And keep in mind that China and Russia are both said to be making efforts to have Americans fight online with other Americans. Now, this doesn't make a whole lot of sense to me because you just saw it on CNN, and I'm going to have a link to that CNN video in my description. If you're trying to stir racial tension in the United States and you're doing it to affect the election, which is going to come up this fall, how, the Democratic, party hasn't picked anyone yet. So how do you know, what your racial tensions, what the effect is going to be? You don't know who, gets more of the black vote or gets more of the Hispanic vote. So, it just doesn't make any sense for Russia to be doing this other than, that's what Russia does. In China, they're not politically charged right now. I read Chinese propaganda on a daily basis, and all of their propaganda is focused on denying that COVID-19 came from China. And, or maybe it did come from China, but it came from a bat. And the bat was either put there by, Americans, by the American Army or by Italy. But, all of their efforts are denying that COVID-19 has anything to do with, the Chinese Communist Party, when in fact it does. So I must do this maybe 10 times a week. When you see a racially charged social media post, or, say you get in a group, Black Lives Matter of New York City or something like that. There's a lot of Black Lives Matter groups. And if you get into a Facebook group like that and you notice that all the moderators are Nigerian, then you might you might suspect that these aren't Americans that are posting all this stuff. Or maybe they are in a legitimate group that was founded before and they joined a group. Drill into their profile, because these Nigerians, they can't make, or Ghana people either, they can't make a sensible profile. They'll get in there and make a profile and say, yeah, I attended the University of Stanford and then I went to Harvard. But if you drill into these profiles and take a look at all the friends, there's only like 20 friends, because that's the people in the room with them together. And their friends are all from Nigeria or Ghana. It's pretty obvious who these people are, because they're not that smart. They're not that familiar with American, with America to make a profile that makes any sense. Okay, I appreciate your time. That's all I have today. Thank you.